Imagine you're in a hospital, visiting someone dear to your heart. You're exhausted. The fluorescent light is cold, the beeping devices are loud, and you are waiting for a doctor, for an answer. I've been there many times accompanying my aging parents. From my experience, the healthcare system, which is supposed to heal and ease suffering, sometimes feel the different. It drains your energy. As a designer, as a lecturer at Bezalel, the leading academy of art and design in Jerusalem, and as a daughter to aging parents, I ask myself a simple question. Can we redesign the hospital experience? For the past 20 years, I've been teaching design thinking in Bezalel. Design thinking is a problem-solving approach which is human-centered that involves understanding user needs, questioning assumptions, showing empathy, and continuously developing and testing solutions. And the most important question in design is not what it looks like, but what it feels like. And then, how can it be better? With that in mind, I approached Soroka Medical Center and I offered a first-of-its-kind collaboration between hospital and design students. And they immediately agreed. Next, I went to speak to my students about designing in a hospital. I told them, we are not going to design medical equipment or technology. We are going to design something entirely different, the human experience in its most vulnerable moments. In 2021, Project Florence was born, named after Florence Nightingale, the founder of modern nursing. The idea was simple: to move the design students from the classroom to the hospital. We set up a design studio in the hospital, but most of the time was spent in the ward, talking to patients, caregivers, and staff. And with the students immersing themselves into the hospital day-to-day life. We know this is the best way to understand the user experience from intake to release and all the challenges in between, and then to try and improve it. We start with one of the 6 pediatric wards at the hospital. There, the staff discovered that patients and their parents were satisfied with the hospital, with the level of medical care, with the nursing staff, even with hospital rooms. But when it came to food, the feedback was entirely different. Hospital meals, which could have been a source of comfort, a moment of joy during difficult time, were in fact sad and depressing. So the hospital management asked us, can you help us turn hospital meals into a joyful experience? With one condition: you can't touch the food. Our response? Challenge accepted. We start by observation. We went into the kitchen, we followed the food cart, we ate with the children, we sat with the parents sitting next to them. We stepped into the shoes of everyone involved, trying to understand why is this happening the way it is. Why our meal times are so sad and depressing? What is causing this discomfort? We know that if you want to fix something, first you need to understand why it feels broken. What we found was surprising. Satisfaction is not about how the food is prepared or even how it tastes. It's about choice. It's about where you eat, alone, in bed, surrounded by mess and noise. It's about when you eat and who you eat with, and even who brings you the tray. We noticed that although the hospital had invested in food ordering app that was supposed to give parents choice and control, hardly anyone used it. Why? Our field observation revealed something the system designers missed. The message, please order your child meal, was sent to the parent who registered the child into the hospital, usually the father, and not to the parent who was with the child in the hospital, usually the mother. Once we understood the real issue, the solution became clear. We designed an inward ordering station so the parents who were actually with the child could order the food. Then we looked at who delivered the meal. We found that it was either the nurse who just gave painful injection or the sanitation worker who also cleaned the toilet. How do you think that child attitude toward the food? It wasn't great. So what did we do to change this experience? We designed special uniform for the food delivery staff. We dressed up the food cart. We even added music to the cart, so every meal will become a special moment. Then we looked at where the children ate. Instead of eating in bed, we prototype foldable cardboard table mounted in the halls. Simple, lightweight tables that gave patients and their parents the opportunity to eat side by side, to sit up, to feel normal for a moment. Next, we tackled one of the most toughest issues in hospital meals, dinner. Due to logistical constraints, dinner is served at 5:30 or 6 p.m. And every parent knows this is way too early for dinner. Children ended up going to bed hungry hours after dinner ended. So how do you respect the hospital needs and the rhythm of free life? We used a design tool called ideation. This is a process that brings all the stakeholders together in one room to brainstorm ideas. In the hospital, we put all the dinner stakeholders together in one room. And for the first time, they had a chance to speak and to listen, to empathize and to understand the real needs of each other. Together, we co-created a solution. A hot dish delivered early by the food service team and a box with additional food that the kids can eat at any time he wants. In the box, we also put a game and a magnetic card that opened the newly installed refrigerator so the kids can take during the night and anytime he wants. And finally, we encounter one of the most critical elements of any innovation project: implementation. Because no matter how great your idea is, without system willing to embrace it, it won't work. Soroka implemented all of our ideas in one pediatric ward. And after 1 year, the food satisfaction level in that ward compared to the other 5 wards went up by 80% compared to the other 5 wards without touching the food. From this first semester in 2021, the Florence Project had continued annually. Every year, a fresh group of design students come to the hospital and looked how to improve another user experience. In 2022, we looked at internal medicine wards and asked, how can we improve the human experience, not of the patient this time, but of the friends and family who accompany them? Quickly, we realized that the hospital, a place that was designed for short visit, is now facing a new reality. Visitors are no longer just visitors. Family caregivers are staying by the patient bedside for 24 hours a day. They become part of the care environment, and they too need services, spaces, and support. We try to understand what are the exact needs of these caregivers. How do they feel spend a full day or few days by their loved one in a small shared hospital room? We mapped the needs and then we designed solutions. Sitting systems, quiet workspaces, area to rest, eat, and recharge. But we didn't stop there. We also redesign and create a new system that formalizes the relationship between caregivers and hospital staff, putting clarity, empathy, and shared understanding into those complex interactions. From our first semester in Soroka, we've noticed a quiet but powerful need, one that doesn't show in any medical records. It is the need for privacy and for dignity, especially in the most vulnerable moments. When patients are being wheeled to the ER or to operations, or for patients at oncology outpatient wards that are often in public or shared spaces. This is where patients feel most vulnerable and exposed with no control. So we ask, how can we give these people a sense of dignity and privacy without interfering with medical treatment? So we designed human-centered solution for patients who are being rushed from the helicopter to the ER. We designed a special stretcher cover that gives them privacy while still allowing necessary life-saving treatment. For children transferred from the hospital ward to the operating room, we created a special bed cover that create comforting private space during this stressful moment while still allowing close connection to the accompanying parent. For patients in oncology wards, we designed a special recliner add-on that allow the patient to put the recliner up or down and to control their privacy. These three solutions may seem small, but they have the power to transform one of the most stressful moments, bringing comfort, dignity, and strength. For the past 5 years, Project Florence has proven that good design can truly transform the human experience. We built a hub of professionals focused on humanity, and for a short time, they changed the hospital experience. As technology accelerates, humanity must not stay behind. Design thinking helps us keep people in the center. It's not a luxury. It must be an essential part in every complex system. I'm proud to share that recently the project was honored by the renowned Don Norman Design for Humanity Award. The design thinking process is simple. Understand the needs, listen deeply, collaborate, co-create, prototype, test, and repeat until you find the right solution. It is simple yet very effective process that enables us as a society to preserve our humanity, to protect the vulnerable, and to become stronger together. Thank you.